Namaste. Health is important for all, and as the WHO has declared that the health of girls and women should be given of utmost significance and importance due to the role they play in the lives of everyone. This also restricts them from receiving good medical care, and it is very vital to understand the factors that affect women's wellness and to nip them in the bud. To help us delve deep into this and clarify all our concerns, we have with us Dr. Ratna Devi, Senior Consultant Radiation Oncologist at Apollo Hospitals Greams Road, Chennai, and Apollo Cancer Center, Teynampet. We're very privileged to have you with us, Doctor. Thank you so much. Why are women more vulnerable to diseases and health conditions, Doctor?
Women are more, a small percentage, I would say, women are more vulnerable to diseases. Is one of that is, I would attribute more to the stress, advancing age, and other comorbid conditions like diabetes, hypertension, obesity, lack of exercise. I can go on with the list. All these contribute to the vulnerability of women being succumbing to many diseases, and even cancer. There is a small preponderance in affecting the women population as compared with the men population.
Is there a biological or gender related reason why women are more exposed to these conditions, Doctor?
I would put it like, as I told you, women's body go through by nature itself through lot of turmoil, I would say, like menarche, menopause, pregnancy. There's so much of changes which happen in a woman's life during her from a menarche, then the pregnancy, then changes which occur because of breastfeeding, then menopausal status. All these have an factor attributed to this stress. So stress itself is a factor which makes it more susceptible for any kind of disease. When you are more stressed, you invite diseases. That is what I would say. And the responsibilities the women carries, especially in the present world, women are doing dual work. One, being a homemaker, being a mother, as well as they are CEOs and marketing managers and doctors and lawyers and homemaids, and a lot of work and both physical and mental they go through to support the family financially and emotionally, psychologically. So much of turmoil is there in a woman's life. All this makes it susceptible, that why they get more vulnerable.
Truly said, Doctor. So, what are these common conditions that women should be aware of?
I would, being an oncologist, I want to stress upon as compared to 20 years back, and now if you compare, the cancer breast is definitely on the rise. And initially we thought breast cancer was affecting only the older people, but now in reality more and more younger women are affected by this breast cancer, which is alarming. And this is something which we need to pay attention to, and awareness is very, very important. More and more younger women, less than even 40 years, we are seeing regularly in our cancer clinics, who are affected by this cancer.
Doctor, it is said that the body weight determines everything, right from prevention of diseases to pregnancy to their menopause and everything in a woman. Why is maintaining an ideal weight so important?
Definitely body weight has a major influence in many of our health issues, be it your diabetes, be it your hypertension, be it even your fatty liver, be it cancer. Everything is determined by body weight. Obesity is becoming a problem nowadays. One, because of our changed lifestyle, very less importance we give to our body weight, I would say. And regular exercise has been proven. 30% of breast cancer can be avoided with regular exercise. Even stress There are many women who come to my clinic, they say, I don't eat much, doctor. I actually have a clear check on what I'm eating, but I'm increasing weight. There are other problems like thyroid issues or any hormonal issues can be contributing to that. Another major factor, again, which contributes to the increase in weight is also stress. So by doing regular exercise, what are we doing? We are trying to keep our body weight under check, and you get happy hormones also, which helps you to beat the stress which you are facing every day to day life. So exercise is a beautiful remedy to get rid of the body weight as well as get rid of your stress.
Doctor, is there any particular foods that women should take or avoid to reduce the risk of cancer?
One of the reason for breast cancer, we know it is a poor dietary intake, a fast food or a quick bite. We would say that I just had a quick bite of a burger or a pizza or a little bit of pasta or noodles, or these are the quick lunches I see people take, or even some biscuits and a tea and many number of coffees and tea which has a lot of sugar content into it. Actually, a balanced diet is very important to maintain your body weight as well as your body health. So definitely you have to have a balanced diet. It cannot be, you cannot throw away the diet saying, I don't have time. No, that is unacceptable. You have to have a proper breakfast and it has to have a balanced diet. You have to have equal amount of minerals, vitamins and proteins and carbs and fat into your diet. You need to have at least 1 or 2 servings of fresh fruits and salads. Being an oncologist, again, I would say antioxidants. Antioxidants are found abundantly in all colored fruits and vegetables, which I want all the women to give that small attention to herself and take this amount of salads and fresh fruits and salads, and it has to be part of their diet.
As you mentioned, doctor, breast cancer cases are rising these days and a lot of younger women are falling a prey to breast cancer. What are the symptoms that we should look out for? And as you always say, early diagnosis is the key.
Yes.
So how do we look out for these symptoms?
First of all, I would appreciate the media coming forward to do this all awareness. This is something very important, and I am seeing the difference of this awareness in my daily clinic. People are more aware of themselves and they do approach the doctor if there is something which is bothering them. And coming to the what are we supposed to be looking, I would also always recommend self-breast examination. Start your self-breast examination as early as possible, even at the age of 20 should be fine. It is a habit. What is self-breast examination? You go into the Google, you will be able to know what all you have to do. It just takes 5 minutes and it is recommended monthly once, especially after your completion of your periods. Just give that 5 minutes to yourself, examine your breast with flat of your fingers, go feel all over the breast, see whether there is any nipple discharge. Do not forget your armpit to see in these areas. Once you are aware or you are familiar with your breast, if there is a small change like any nipple discharge or anything like a flaky skin, or if there is a lump, I'm sure you will be able to pick it up. And once you pick it up, you just don't stay at home, you come and approach your doctor. Again, when I say about self-breast examination, I want to tell you one thing, not all lumps are cancer. 80% of lumps in the breast are benign. But who's going to tell you whether it's benign or malignant? It is going to be a doctor who is going to help you to find out. So if you find out a lump at very early stage, and you can easily save your breast and your life as well.
Doctor, coming to the next aspect of cancer that women need to focus on, cervical cancer.
Yes.
What is cervical cancer and what are the causal agents of cervical cancer, doctor? We feel that there is very minimal information available today about it.
That's a very good question. I do feel that. So there has been a lot of awareness on the breast cancer. But as compared to the breast cancer, cervical cancer awareness is a little low. Cervix is a part which is the opening of your uterus. It will be like a mouth. It has got an upper lip and a lower lip, and that is place we call it as cervix. This cervix is one of the or second most common cancer in women. Who are the people who get affected? Early marriage, early sexual intercourse, multiparity, HPV virus, or even smoking is one of these common factor which increases the risk of developing the cervical cancer. What happens in an early marriage or an early intercourse or multiparity, this area called the squamocolumnar junction, which is at a lower level, as the girl ages, this squamocolumnar junction raises up. But if a girl gets married at a very younger age and she gives birth to children, and multiparity means multiple pregnancies and multiple children, all these causes bruises in this area. That is, bruises means it keeps affecting this squamocolumnar junction, which develops into cancer in a later age. And again, HPV virus. This mostly in cancer, we don't talk about viral etiology at all. If you see, whenever I speak about breast cancer or any other cancer, I will be talking about the obesity, I will talk about hypertension and diabetes. But this cancer, I'm talking about a virus etiology, which is called as a human papilloma virus. It spreads from one person to other through sexual intercourse. And this HPV virus gets deposited in the women in the cervical area, which develops into cancer in later age.
Doctor, when should a girl or a woman start regular screening for various cancers, such as breast cancer, ovarian cancer, or cervical cancer?
I would say you start as early as possible. One, self breast examination. You're not going into any clinic or anything. You do at your home. And any sexually active women, please go check for cervical cancer. It is a simple test which we do, which we call it as a smear test or pap smear test. We scrape out few cells through a brush and put it under the detection of the microscope. If there is any changes, we let the patient know about it and then take adequate precaution or remedy to prevent that cancer. So these are very much screenable cancer, and it can be well prevented with awareness. As far as the breast cancer is concerned, like above the age of 40, if you are not coming under risk group, you please subject yourself for an X-ray mammogram or any mammogram or MRI mammogram or whatever your doctor is going to recommend for, and that is the age for screening for breast cancer. If you come under the risk group, then I would recommend you to start visiting your doctor from the age of 35.
Doctor, speaking of screening and prevention, cervical cancer has a vaccine that women can take. Can you elaborate a bit about it?
Yes. We started off talking about prevention. I would just want to stress one point. 90% or over 90% of cancer is curable if detected early. That is why awareness is very, very important, and you being aware of your organ or body is very important. And coming to the prevention by vaccine, yes, I told you there is a virus which is involved in the cervical cancer, which is called as a human papilloma virus. And since it is a virus, we have a vaccine also to prevent this cancer. Who are the people? The recommended age is between 9 to 26 years. It is given in most of the clinics by gynecologists or emergency areas where this vaccine is very much available. It is given in the deltoid area. The deltoid is the arm. That is where it is given. It's a pretty effective vaccine against this human papilloma virus.
Doctor, let's move on to the next type of cancer, uterine cancer. How is uterine cancer caused, and what are the signs that we should look for?
We were talking about the cervical cancer, and this is sexually active women, and much younger women are affected by the cervical cancer. Just above that is the uterus, the endometrium. This is another area where most of us are not having enough awareness. And advancing age, postmenopausal women are the ones who are basically affected. Breast cancer and uterine cancer have a lot of common risk factors, like what? One, is obesity, hypertension, diabetes, no children, nulliparous, or one child. And these are the factors which contribute to increase the risk of this uterine cancer. Uterine cancer is usually how it presents with a postmenopausal bleeding. What do you mean by menopause? Menopause is cessation of your periods. After cessation of periods, if you get blood, it is not normal. You have to look into it. Most of the women, I just had bleeding after menopause after 10 years, just a little bit. So I thought it was not, it didn't trouble me, so I didn't go and check. No, that should not be right. It is a symptom which is showing you, or a sign which is showing you there is something abnormal there. And postmenopausal women, you have to be regularly going to your gynecologist to check up. Menopause is no excuse to tell that I did not go to my gynecologist to check myself. It's wrong. However, how much you are paying attention for your breast, you should pay attention for your cervix and uterus as well.
Doctor, does pregnancy and breastfeeding help in the prevention of breast and uterine cancer? If yes, why does that happen?
That's a very nice question. Yes, breastfeeding is definitely protective against the breast cancer and ovarian cancer. Breastfeeding, actually, two things I would think of. One, when the woman is breastfeeding, usually we look into the diet, because whatever we eat is what is going to the child. So when we look into the diet and we keep our weight under check, that itself is a preventive factor. And the other factor, there is a lot of shed of breast tissue which happens during the breastfeeding. Probably the defective DNA is getting shed off. That helps in the prevention of breast cancer as well as your ovarian cancer. One of the most important factor about breastfeeding is it is not only good for the mother's health, it is good for the child's health. You are actually giving a very healthy baby to the society by means of breastfeeding. Breastfeeding, exclusive breastfeeding for 1 year is what we all recommend, which is very, very healthy for both mother and the child.
Thank you, Doctor. So, what are the treatment methodologies that are introduced in the management of cancer in women, Doctor, today?
When it comes to oncology, there are three main branches. One is my branch, which is the radiation oncology, surgical oncology, and medical oncology. There has been a tremendous growth. Like how the cancer is challenging, we have been equally challenging that we are developing more and more technologies and medicines and surgical techniques to fight this deadly disease called cancer. Coming into the radiation oncology, we have cyberknife radiosurgeries, we have proton beam radiotherapy. All these are great and big developments which has happened in my field. What we could not address in those days, we started addressing now. Another major point I would say with the proton beam radiation, it has very, very less side effect. Re-radiation is possible. Pediatric cancers, it is beautifully helping. In brain tumors, it is definitely a boon, I would say. And re-radiation, which we never even thought of in the past, has become a possibility and helping the patient in recurrent diseases. So the developments in radiation oncology has been tremendous, and I would say it is a real leap in the oncology field. Likewise, in the surgical field, if you take, there is robotic surgeries where we used to, in the past, when the open surgeries had lot of complications and lot of pain, and there was a lot of risk which was involved. All these are bridged with robotic surgeries, where the surgeon's hand cannot turn completely. The robo helps, and even in deeper pelvic tumors, I think it is a wonderful tool. With the laparoscopy, where we do keyhole surgeries with very minimal damage to the tissue, again, I think it is a beautiful development. And in sentinel lymph node biopsy in means of breast cancer and other cancers, where very minimal damage happens to the tissue, whereas we are able to get a cure on those patients. Same way, with the medical oncology, we have targeted therapies, we have immune therapy. All these are playing a major role in curing cancer, where we thought we had no remedy for certain cancers. Now we have remedy, and it is very promising.
Does proton therapy also help in women handling their and managing their cancers, doctor?
Definitely, madam. Definitely. Proton therapy, especially with the left-sided breast cancer, it is definitely a very big boon. The heart and the lungs, practically there is no radiation to these underlying structures, whereas we are able to go properly to the left breast with the breast conservation surgery, where we do most of the times these days. And absolutely, we are able to protect the women from the major side effects which caused because of the previous kind of techniques. Proton therapy, I say, it is a boon in these cancers. And again, in uterine cancer, cervical cancer, pelvic tumors, and lot other cancers, proton beam radiotherapy has proven to be a real boon in the treatment of cancer, not only for women but for both women and men and pediatrics. And when we talk about cancer breast has got a tendency to go into other parts of the body like lung, liver, bone, or brain. Before, when it spreads to these, we only used to do only palliative, that is only relief from the symptoms. Nowadays, when there is a condition called oligometastasis, we go all way to clear the disease and to attempt cure in these patients. In these kind of situations, again, proton beam radiotherapy is playing a major role depending upon the site where the patient has been affected.
Doctor, could you share some light on the common preventive measures that women could take to curb the risk of developing any cancers in the future?
One thing is, give that importance to yourself. You are an important person, not only to your family but to the society. You are the backbone. If your health is fine and you are taking care for yourself, more and more wonders you can do, madam. You please believe that you are a very important person to your home and to the society. Number 2, please pay attention to your diet. Give that little bit more importance, like how you take care of your family members. Give that same importance. Eat a balanced diet. All of us are going through stress. Try to keep your stress under control. Don't do any binge eating. Do not just take quick bites. Don't take too much of coffee and tea. And I mean, these are generally, I would say, taking too much of anything is not good. No smoking. Do your regular exercise. Please do your regular exercise. Keep your body weight under check and keep yourself happy. That is the most important. And a whole life, what are we running behind, is to have a happy and peaceful life. Please pay importance to yourself, will be my only message to all the women viewers of this show.
Thank you very much, Doctor. That was a very enlightening conversation to clarify all our concerns about all the cancers and all the conditions that can affect our women in future. For appointments with Dr. Ratna Devi, Senior Consultant Radiation Oncologist at Apollo Hospitals, Greams Road, Chennai, and Apollo Cancer Center, Teynampet, please call 044 4040 1066. I repeat, 4040 1066. Thank you very much, Doctor.
Thank you.
Thank you, viewers.